welcome to the Association for Better New York's Power Panel on Vaccine Equity in New York City. We have an incredible group of significant voices and leaders in our city this morning, and I am so excited about this. I want to thank the Black NYC Task Force for Vaccine Equity and Education for presenting this event with us. This task force is a group of Black leaders who are working to, one, ensure the COVID vaccine is readily accessible to Black New Yorkers, and two, to address concerns in Black communities about the safety and efficacy of the vaccine. At this time in our history, a healthy, strong, and vibrant New York really depends on this vaccine. You can feel in the streets of the city there are more activity, kids are back to school, more and more people are talking about returning to their offices. But there are real ongoing concerns that we have to be careful about as variants spread. Earlier this year, as the vaccine was starting to be rolled out, ABNY commissioned the first citywide poll on vaccine adoption. Our survey found hesitancy in our city's Black communities. We learned that 20% of Black respondents remained unsure if they will accept a COVID-19 vaccination, and that 8% of Black respondents were likely to refuse the vaccine entirely. That is 4 times greater than white or AAPI respondents, and twice as likely as Latinx community members who took the poll. As New Yorkers, we need to work together to listen to the concerns of those who are hesitant and provide them the information that they need. And we must make sure that everyone in our city has equal access to the vaccine. It needs to be available in all neighborhoods and to all people. That's what today's event is about. And here to introduce this incredibly distinguished panel and to get this important conversation started is ABNY CEO, someone who I have been lucky enough to work with and witness firsthand her powerful actions and her amazing voice on behalf of our city and our communities, Melva Miller. Over to you, Melva.
Thank you so much, Stephen. Good morning, everyone. Thank you so much for joining us for this extremely important discussion about vaccine hesitancy and how we are going to get New Yorkers vaccinated so that we can open up our city, and talk a little bit about the disparities that we've experienced across the city that's representative of across the nation of some of the difficulties that we have faced. Before I introduce our very esteemed panel, I just want to talk a little bit about the poll that Stephen mentioned earlier, right? So earlier this year, ABNY wanted to figure out how we could be helpful in making sure that New Yorkers are safe to move around as we look to reopen our city and our economy. We know that the number one priority is to make sure that the city is safe. And we know, and is evident in the COVID-19 pandemic, that this health crisis has not affected all New Yorkers equally, right? Like, we know that BIPOC communities, Black, Indigenous, and communities of color have been disproportionately affected in a number of ways by this pandemic. So just to talk a little bit about the poll a little bit, we solicit the services of a consultant to really understand sort of what New Yorkers were thinking around not only COVID, but getting vaccinated. And while the poll suggests that overall vaccine hesitancy is low among New Yorkers, about 4% saying that they would never take it and 14% unsure, we saw a huge reluctance among African-American residents and other residents like Asian Americans specifically. Now, these are communities with deep distrust with healthcare systems, right, that are responsible for their well-being. Not to mention long-standing systematic health and social inequities in these communities, the same communities that bore the brunt of the COVID-related infections and deaths, right, that we saw. So, for example, when we look at the data, 58% of Black or African-American residents are most likely to feel that the healthcare system does not look out for their interests. And we feel that every day in our communities, right? And this is contributing to the vaccine hesitancy. When we look at places like the Bronx, right, there was nearly 1 in every 10 Bronx residents that said that they will never take the vaccine. We need to do something about this. And this disparity in vaccine adoption is huge. Look, these are the same communities that have been hit the hardest by the virus. African Americans in particularly need the most convincing. And that's what we're here to talk about today. We can't let the same patterns that hurt our communities of color during this pandemic play out in the vaccines. So if the data tells us anything, it tells us that 1 in 3 New Yorkers are for the most part hesitant to get vaccinated. And the data tells us that the most important factor in gaining New Yorkers' trust is to see others around them that have been vaccinated without issues. And we're going to talk about that today. So we should just simply work together to get more New Yorkers vaccinated, to get more New Yorkers to accept the reality of the safety of the vaccine. We also know that the 2 most common factors contributing to the vaccine hesitancy is the concerns about the side effects from the vaccine or whether or not the vaccine will actually prevent COVID. White responders are least skeptical about the effectiveness of the vaccine. And in contrast, the large majority of Black residents, about 80%, and Hispanic residents, about 69%, say that concerns about effectiveness are to some degree significantly shaped their decision or whether or not to get the vaccine. So today, we have a very esteemed panelist to talk about sort of their experience working on the task force, working in their organizations around helping to get New Yorkers vaccinated. So I'm going to quickly run through who the panelists are, and then I'm going to ask them to introduce themselves in terms of the work that they have been doing around getting New Yorkers vaccinated. So first, I'm going to start, we have with us Arba Rice, who is the president and CEO of the New York Urban League, an organization whose mission is to enable African Americans and other underserved communities to secure a first-class education, economic self-reliance, and equal respect of civil rights through programs, services, and advocacy. Dr. Hazel Dukes, Mama Dukes, who is the president of the NAACP New York State Conference and a member of the NAACP National Board of Directors, a member of the NAACP Executive Committee, and well as an active member of various NAACP boards and subcommittees. But more importantly, her dedication to human rights and equality is really evident and exemplified in her role in linking sort of all of New Yorkers across the state, whether it be business, whether it be in government, whether it be social justice issues. She is a true champion and has been for a very long time. Jennifer Jones Austin, JJA as I like to call her. She is the CEO and Executive Director of FPWA, which is an anti-poverty policy and advocacy organization with over 150 members and partners. Jennifer Jones Austin has led and secured monumental changes in social policy. She's involved in so many important initiatives across the city and in charge of so many important initiatives across the city. And her experience in law in New York State has really been exemplified in her success to strengthen and empower the disenfranchised and marginalized communities. And last and certainly not least is the former Ohio State Senator Nina Turner, one of the nation's leading political strategists, she's also known as a hell-raising humanitarian. And she is an engaging motivational speaker, and she has galvanized the voice for change across this country. She is a champion for economic fairness, racial justice, workers' rights, voter rights, criminal justice reform, and reproductive freedom. And with that, I'd like the panelists just to talk a little bit about the work that they have been doing in their spaces around vaccine hesitancy and making sure, especially in communities of color, African-American, Black communities specifically, to make sure that our communities are safe. So first, I'd like to start with JJA.
Well, I'm so honored to be here. Honored to be with you. Always enjoy getting into good trouble with you, Ms. Miller, as we have most recently with the census. And I just want to applaud and commend you for your leadership efforts, Stephen, and all of ABNY for helping us to get to where we did with the census. We held on to a seat, and that's most important, most critically important. So I want to thank you for your leadership there. And I also just want to acknowledge that it's a joy, a little intimidating, but nonetheless a joy to be on this panel with these distinguished women, just leading in so many ways. For me, the work around COVID began with, and the vaccine began early on. I took it as a personal responsibility to try to use the platforms available to me to help address fear and keep people centered on the positive. Even in the darkest COVID moments, centering on what we were learning and how we were growing, and just trying to stay child of faith, ever faithful, ever faithful. As the news of the vaccine started coming out, and learning about the clinical trials, I took it upon myself to try to use again whatever platforms I had to keep the information current and to help kind of people dissect the information. Working on through the various platforms I have, social media, radio, other outlets, a couple of television appearances, really centering on what we were learning in real time. Because what I've found is that sometimes people feel like the information is just kind of forced upon them. And if you keep them current with the information and they grow with it, we all grow together. And so I've been trying to do some of that. Additionally, what I'll say is that I've been trying to use the platforms to dispel the myths, having pop-up talks about the vaccine wherever, however I can, to both provide information and discount some of the negative and some of the myths. So for me, it's been a big information campaign, and doing that with my organization.
Thank you. And thank you for all that. I see you everywhere talking about it, which is great. And we know how important trusted messages are, and sort of getting people to sort of sign on and be okay with this. So thank you, Jennifer. Next, I'd like to ask Dr. Dukes, Mama Dukes, if you could tell us a little bit about sort of your work in this space.
Thank you. I want to join Jennifer in saying thanks to Abby for the work that you helped us with the census. And it's always a joy to be with my sister friends, Arba, Jennifer, and Nina. I joined Nina as the hellraiser of the group. Being on the task force and being a trusted voice, I immediately went to Harlem Hospital, which is in my neighborhood. I live in Harlem. Arba and I share Harlem residence. And so we say what happened in Harlem is the world. That's what we think. So I took my vaccination at Harlem Hospital, and of course, put it on social media and had everyone to see that it was for real. I live in Lenox Terrace, which is a known housing here, and around me is Riverton, Lincoln Houses, which is a New York City Housing Authority, and Esplanade Garden. And so I had a platform of persons that I could get on the phone and call. I've worked with these tenants associations. I've worked with presidents of the group, former Assemblyman Keith Wright lived in the Riverton. And so I had access to persons that we have worked on many other issues of social justice and health, because we fought for Harlem Hospital on many occasions. And let me just give kudos to Jennifer for not only that, but she put together a panel for the links. She's so modest, she won't tell those kind of things that she done for us in the community. She put together, brought in experts to speak about it, and so did Nina. Because I didn't know right in our midst in Brooklyn that we had this fabulous physician who could speak to us in our language and knew our language. And so I began to, after listening to Arva and Jennifer bringing in experts, I really got on the testimony group. And I was testifying all over the place. For me, I had no side effects, none, with either one of mine. So I was a true testament in my building. When I would go down to get my mail, I would see my residents and I said, have you had your vaccination? They said, no, because I don't want to get, I can't go through this whole thing. And so Arva and people in Brooklyn, we began to have weekly meetings on this. And I was the voice to say, I am sick and tired of talking about you have to register. Let's get anybody walk in. Well, it took a long time because you know the story of the vaccine, but now we have it. Now we have the walk-ins. That was one of my biggest, to the governor, to all of the governor people I was fighting every day. People don't know anything about getting on the computer. They don't have a computer. They don't have Wi-Fi. Just let my community walk in. And so it's finally here now, and I'm pushing them to walk in. Before we got on, one of my residents here, 80 years old, he had sworn to me, we'd had arguments, he would never go. I got him to walk into Abyssinia yesterday. So I'm testifying. I am still on it because we are not over it yet. And for the task force, I learned a great deal, met new friends. But for my sister friends, Ava, Jennifer, and Nina, we've been on this journey for a long time. And we know all the ifs. We know all of the disparities that happen in our communities, has happened in our family. But we got to get over that because we got to get back out.
Thank you, Mama Susan. Thank you for being the hellraiser that you are. So next, Arva, if you could tell us a little bit about the work that you've been doing in this space.
Thank yous and appreciation once again to Abney, and being able to be on this panel with these amazing sisters is just wonderful. It's always hard to go after Jennifer and Ma Dukes because, you know, all that's been said has been said so wonderfully and well. This work it's personal. It's the work of leading a nonprofit organization. And it's also the work of working in community, right? So as we were having the challenges around getting access, because I know right now we're talking about hesitancy, but I still think it's really important that we do not forget the fact that we knew already when the vaccine was about to be rolled out, what were the zip codes that had been hit hardest by COVID. We knew that already. And yet we put together a strategy that was based in a web-based solution. A web-based solution for folks who are seniors and people who did not have access to Wi-Fi at the level of other places. So the fact that we put in place a solution that didn't fit the problem is what we are still chasing behind right now, right? So I don't want us to forget that in running to the idea and notion that all Black folks just don't want to take the vaccine, when we were literally dying to get it, that it was such a struggle. So it was an issue that was personal at first. I have, you know, my mom's in Texas, and I was like literally telling my family, y'all got till March 15th to get mommy the shot, or else I'm flying her to New York. We're taking her to Harlem Hospital and she's getting the shot. So it was a personal level. It was dealing with staff members. My staff members have a tendency to be on the younger end. So initially they were not eligible for the vaccine, but in having conversations with them, they were less likely to want to be at the front of the line. They wanted to be at the middle of the line. They wanted to see how it was going. So we had to have conversations at the staff level, and then obviously working in the community. One of the things that Ma Dukes talked about was it was really important for us to develop the access. So we developed a really terrific partnership with Harlem Hospital, so that we were able to say we've got, you know, a list of folks who need to get this vaccine, and just being able to work with them having their commitment to really serving their communities, because they, like so many other hospitals around the country, initially the RSVPs did come in from people that did not look like us, right? So they were the ones who were initially taking up those RSVPs. But like you've heard, it's been really important. I have my second shot is tomorrow. So it's important for us to take the photos, to say that we're okay, that, you know, we didn't turn into a zombie, nothing fell off of our arms, nothing crazy happened, and we had the vaccine. And even if you did have milder side effects, having those side effects is better than actually having COVID. Right. And so to being able to continue to do that message. Jennifer put together an amazing fact book for us. And so we've been able to utilize that and to share it on social media. And we feel like that's going to be something that we continue to do. But this work has been a journey, and it will continue to be a journey as we move from access, which I think was the hugest issue at first, to actually moving towards some of the folks who are still, you know, hesitant about taking the vaccine.
Thank you. And thank you for bringing up that point about access, because, you know, that's always missed, right? When we talk about sort of communities that traditionally don't do something, it's usually for a reason, right? One of the biggest reasons is access and opportunity to the things. So thank you for bringing up that point about the limitations and actually getting to the vaccine for those who actually wanted it in the Black community. And last, but definitely not least, Senator Turner, tell us a little bit about your work that you've been doing around this.
Thank you, Sister Melba. And I just have to say, ooh-wee. Being on this panel with all of my sisters, I am definitely in awe. And just the work that we've been doing collectively. And to Mama Dukes, I just want to be Mama Dukes when I grow up, because I wish, you know, I could. I have been vaccinated, and I'm telling you, that second shot was something else. But as Sister Rice just laid out there is better than getting it. And I know people span the gamut from not having any side effects at all to having some side effects. That is not just about the vaccine, this COVID vaccine, that happens with any vaccine. And I think it is important. And the task force, what I really love about the name of the task force in terms of equity and education, because we came together knowing that we have to press the powers that be to understand that equity is important and education is important. Those two things go hand in hand. There's a difference between equity and equality. Equity says that we're going to get people what they need, even if what they may need is a little more than another community. It is about equity. And Ma Dukes is absolutely right. I remember being on those calls with her when she was very clear about the digital divide and how the Black community communes. And it is not always over social media or having access to email. Allow the leaders in the community, those grassroots leaders in the community, be the leaders. And just also, listening to my sisters, it also reminds me of a song in the Christian tradition, "This Little Light of Mine, I'm going to let it shine." And that really is a reflection of everything that has been said before my comments. They said it all. So I am just here to put an amen on that point. And for JJA and her team, the Roll Up Your Sleeve campaign, absolutely phenomenal. It's an excellent guidebook about the vaccine itself, what to expect, how important it is, and what we can do. Roll up your sleeve. I see it in two ways. One, roll up your sleeves to get to be vaccinated, but also roll up your sleeves to get into the trenches and compel the people to come help our community. God knows that what is happening with this COVID, this pandemic, is just really revealing the fissures that are already inherent in the system itself, that healthcare disparity is real. And the African American community tends to always be, unfortunately, the canary in the coal mine. And so to have that task force really lay that out and tackle that, and to have other people, we represent a portion of that task force, but to have other people like Mark Mariel, who leads the Urban League, and Reverend Al Sharpton from NAN, and just so many other leaders who both represent the national, but also the grassroots of New York. New York absolutely can be a model. Our task force can be a model for what can be done all across this country. All of us have a role to play in dealing with the access issue. And Congresswoman Karen Bass most recently held a forum about that, a webinar, if you will, about that, where doctors and other experts were talking about what we're saying right now, that this is not just about hesitancy, it is also about access. We know that Black people are dying 2 to 3 times higher rates than others of our sisters and brothers in this country. No surprise there, because almost every single health disparity to the negative impacts the African American community in that way. We're being hospitalized at higher rates. So what is our collective responsibility to ensure that we both educate our community, but also force the people with the fancy titles and the power to understand that this is an opportunity not only to help Black and brown and left behind communities get vaccinated, this is an opportunity long range to deal with health disparities in the United States of America. We're not going to just stop at COVID. Let's just go ahead and go all the way and deal with health disparities in the United States of America while we're dealing with COVID.
Amen. And thank you for always keeping us on task around sort of taking this beyond just COVID, right? Senator Turner, I'm so honored to have joined the task force a little later. And thank you for allowing me to join you guys on this journey. But you guys have really been doing some amazing work for some time now around this. And, Senator Turner, you always sort of keep us on task that, this is larger than COVID, that this is an effort that needs to continue to address sort of health disparities for, Black communities in particular. And thank you for keeping us on that task. And I love your point about sort of rolling up our sleeves and putting in the work to get people sort of vaccinated, right? So it's not about a campaign to get just people vaccinated, but enlist people in the effort to do it, right? And what I'm really interested in, if you all could just talk a little bit about sort of your work in the trenches around the biggest challenge, right? We heard, sort of access. We heard about hesitancy, but what does that really mean? I would love to hear a little bit about what the biggest challenges to getting New Yorkers vaccinated has been in your experience. And as the rollout has sort of progressed, have you seen a change in that, right? Are more people being able to get vaccine, or are there still trouble spots that we need to focus on? But I'm really interested in how, your experience in terms of the challenges has been. So I don't know.
I'll jump in. And the first thing I just want to, for clarification, because the lawyer in me has to issue a point of clarification. The toolkit that we're talking about was a collective effort. FBWA, did the coordination and ushering it in, but it would not have been made possible. It would not have been possible had it not been for the members of the task force leaning in, being a reflective and representative voice to make it what it should be. What I will tell you is that we realized we needed a toolkit early on because, as Dr. Duke said, access was a problem. There were many people who wanted to get the vaccine in the Black community, but couldn't access it because they didn't know where to go and get it. They didn't have information readily available when sites were going up. Broadband is still an issue. And as Dr. Duke said, she's taking care of a lot of that, but people just didn't even know where to go. And so we created this digital toolkit to provide, first to acknowledge fears and concerns that people had about the efficacy of it, about the safety of it, as well as about, was it really going to be for them or was it for somebody else? I can't tell you how many times I heard people in the Black community say, they're going to give those persons the vaccine and they're going to give us like the placebo, right? Or they're going to give us. We created the toolkit that dispels some of those fears, to acknowledge them, but then also to provide information to counter them in an honest and transparent way. And then what we wanted to do was to give people messaging so that we could have ambassadors out there saying, this is what this is all about, and this is how I need to talk to mom. This is how I need to talk to the lady down the street or the person in my church. And then again, giving them the information about where to go and get it. What I will tell you is, still being in the trenches, the information is now out there in abundance. But what we're beginning to see is that some people are becoming more and more settled in their thoughts and in their beliefs, which is surprising because the clock is now running. Earlier on, we heard people saying, well, they say it takes 14 months on average to create a vaccine. So I'm just going to sit back and I'm going to wait. We're now at and beyond that 14-month point, right? So come on in. But now you've got people who are saying, well, I've survived COVID thus far, so I'm good to go. Or you know what, that herd immunity that they talk about, they say it's got to be 70 or 80%. Let it be those 70 to 80%. And what we're trying to help people understand in the trenches right now is part of saving our community. My biggest concern when I'm in the trenches is, and I say this as a Black woman, appreciating how often we have been left out. How often people have said that we have access to something, but we don't really have the opportunity to avail ourselves of it. I'm constantly saying, we're bringing it to you. Mama Dukes has done the work of bringing it to you. Our senator's done the work of bringing it to you, right? President Arthur Rice has done the work of bringing it to you. Now take advantage of it because you don't want to be left out. And then in the long run, be complete. So the work in the trenches is trying to overcome that sense of it's not about us and people aren't caring for us. No, we're here and we're doing that. It's continually trying to overcome that fear and letting people know we're with you. We're riding with you and we're making sure you have the access.
Thank you.
Let me just say, following up on my sister Jennifer, my link sister Jennifer, it was amazing that when she put the forum together for the links, these are people who are educated. She brought a different voice. We brought people who had lost family members. We had persons who had side effects. We brought people who had COVID. These are educated women. I mean, the participant and the questions and the follow-up was amazing. And it was because we were ambassadors. And let me just say about Sister Nina, when you talk about hard work, you came on lately. Oh my God, we had meetings on Fridays in the afternoon. Nina Turner would get on that call with Reverend Sharpton and Sister Jennifer to get this toolkit together. I said, oh my God, this is coming to be, I'm going to get a master's in COVID. It was so intense, but we got it done. And the ministers, we can't forget the Black church. You know, a lot of people said, no, that's not true. That's not true. And when the ministers, when Reverend Sharpton and Reverend Butts took on the healthy, whatever we was calling that, and got in, and Reverend Sharpton took his vaccination at Harlem Hospital. You know, it was a thing in Harlem. Sister Rice will tell you, people said, I will never go to Harlem. I will go to St. Luke, or I will go to Mount Sinai or Columbia Presbyterian. Let me tell you, when they saw other people was coming into our community, getting our vaccine, they went, wow, get out of here. This is our community. New York Times reported a woman going to the armory with her poodle and got out of a limousine. Well, that turned people on that we better start getting this stuff. So it's like show and tell out here. And I said, every day I'm testifying to someone. You know, I get my mail and I said, have you had your vaccination yet, with my mask on? And they have their mask on. And they said, well, no, I was waiting. And then I get into my spiel. And I think it's each one teach one, wherever we are in this. And so that's the work that we got to continue to do. And the access was really a problem. And as Sister Jennifer said, now we have it, you know. So go to Abyssinia, go get it. You don't have to do anything but walk in. It's not even a line. And so that's how forceful we have to be to our community. We have fought hard. We kicked butts with the governor and with the mayor, the city of New York. Stop this about you have to go online and find out where it is. Our people not going to do that. And so now we have it. And so we're going to tell them, we worked hard. We brought it to you. Now we want you to be safe. We want our community to be safe. Come on and get it.
Thank you. All right, you want to jump in about obstacles?
Yes, absolutely. When we talked about the challenge that we've been facing, I also wanted to talk a little bit about the opportunity, right? So we're starting to hear more people talk about going back into the workplace this fall. So I think that particularly ABNY has a responsibility and an opportunity to start to talk to employers, right? So as individuals are starting to go back to work, many of the people in our communities never were able to take off, but as people start to go in larger numbers back into work, what does that mean? What does it mean for being able for employers to give people specific hours to be able to go and get the vaccine, and to give opportunities for, you know, if you don't feel well, that they might be able to take sick time and have paid sick time for that, but to be very thoughtful about what the transition is back into work. The hesitancy that we've seen and experienced is on both ends. There's people who've already had COVID, so they feel like the antibodies will carry them through. So why do they have to get the vaccine? So there's education that needs to be done for those folks. Then there's people that are just, you know, they're healthy. They feel like it won't touch them. You know, they're kind of, as Governor Cuomo refers to them, you know, they think they're superheroes. So they don't need to have this vaccine. So there's the conversations that we need to have with those folks. And then there's the people who we've already talked about who have had this historic, whether it's the Tuskegee experiment and or it's having gone to and interacted with the healthcare system last week. So it could be a historical bad experience, or it could be one that they just had. So why in the world would they want to take this vaccine? So there's all the messages that need to go to all those different types of people. But it's also the opportunity that we have that when they go back into the workplace to support them and to not just issue edicts that say, you know, everybody has to have the vaccine in order to go to the next game, but around like, what is it that we do to support people so that if they do get the vaccine, that if they do feel sick, that they know that that's not going to mean that their families don't eat for a week. And I think people need to think about that all the way down to its impact. It's not just taking the vaccine, but how can we support them all the way through in order to help make sure that happens. And I think that that's the opportunity.
Senator, do you want to talk a little bit about? Sure. Okay.
Yeah, thank you, Sister Miller. I do want to add to something that President Rice said about the opportunity. I often say that there's promise in the problem. And we do have to see that promise while we're dealing with the problem. You know, there are articles out right now that are really indicating that a lot of people are not going to get that second shot. So if they didn't get the Johnson and Johnson, some people are not going to get the second shot for various reasons. And all of my sisters have laid those out, whether it's I work at a job where I can't necessarily afford to go get the second shot, to I got one shot and that should be enough. And so we are going to have to deal with that very real reality of ensuring that the people that we have gotten there to at least get the first shot, that they go and get the second shot to finish this through. Promising the problem also says that, again, beyond the pandemic, what are we going to do to deal with the health disparities? As President Rice just laid out, it could be something as far back as our history in terms of how the African American community is dealt with or not dealt with in the healthcare industry, or it could be I was just discriminated against 2 days ago or just yesterday, and I just don't feel as though there's a lot of weight. Also, I just want to put into this space on the African American community in particular, but all of this country in general, which is, you know, I don't know if calling this the post-traumatic stress disorder actually fits for the African American community, but the trauma that our people are under on top of COVID, with all of the police violence and other violence that we see, this stuff is stressful and it is hard and it exacerbates other things that are naturally occurring in life that I believe is also hurting the African American community. And so we need professionals and people in these places and spaces to understand that more global, larger trauma that is also impacting hesitancy and also access, the stressors of just being Black in America, and it's playing out in real time over and over and over and over again, and you never get a chance to reset in a way. That is a heavy burden for our community to constantly carry all the time, over and over again. And so how do we find ways to deal with all of these things at the same time? Some of these things have to be dealt with in very deep, strategic, laser focused, on purpose, not by accident, ways. And they all go hand in hand, this trauma that our community is experiencing right now.
You know, if I can just quickly add on to that, it's such an important point, especially when you think about the irony in this moment. So we are trying to ensure that all Black persons receive this vaccine so that they can, come through COVID, have lost jobs and having experience. Not just a year, but as you said, Senator Turner, and you said, President Rice, you, Dr. Dukes, not just a year, but decades of discrimination, trauma, marginalization, oppression. And so the irony of it is that we now need Black Americans to get this vaccine so we can get full herd immunity. But you weren't concerned there's also this mindset of you weren't concerned about me when I was dying disproportionately from cancer, breast cancer, or heart disease, or obesity, or diabetes, environmental racism, right? Low income, inequitable wages. You weren't concerned about any of that. But now you're coming for me because you need me in order to get back to normalcy. We've got to confront that tension as a society. Now we are essential for vaccination purposes, but we're not essential every other day to prop this nation up. That's an inherent struggle, and it's mental, it's emotional, it's physical, and it manifests in this trauma. That has to be seen, acknowledged, and dealt with.
I love it. I love the way you all sort of brought the intersectionality of all of the issues that Black communities are facing. And that exacerbates what COVID-19 means for us, right? And I think, I applaud you all for the work that you do, not only around COVID, but every day, right, in the trenches, because it goes beyond, right? I think we all fight for what we fight for because we care. And there's so many different issues that we're working on that we can't afford to give up, right? We have to tackle COVID. We have to tackle health inequities across the board, right? Inequitable wages, as JJA talked about, right? There's all these intersectional issues that we deal with on a daily basis. And we bear the brunt of all of this work. And that brings me really to my next question, and this is for Senator Turner. We can't do it by ourselves, right? Like, we need our partners, especially our partners in government. And, I'd love to hear sort of the work that the task force has done with the city, but specifically with the governor and the state to achieve these goals, right? And how has this task force worked with the governor's task force on vaccine equity? And has it been helpful? In what ways has it been helpful, and what can we do better? But I'm really interested in hearing Senator Turner, if you could talk a little bit about the relationship between this task force and the work specifically with the governor's task force on equity.
Yeah, thank you for that, Sister Melba. It has been extraordinary. I mean, we know, definitely giving Governor Cuomo credit for his leadership on this issue in the great state of New York, and understanding very clearly he could not do that alone. And also to our very own Charlie King. The task force itself is really a reflection of understanding that we cannot go it alone. And so to that end, the task force on equity and education definitely set the frame for the governor's task force. And those members from the governor's administration have been on our task force meetings, as my sisters will attest, over and over again, giving us updates about what is going on. It allowed for expansion, for example, into the public housing facilities too, which was very important to go and get our sisters and brothers that live in those communities and make it readily available for them, and not having them have to jump a whole lot of hoops to be able to get access to the vaccine. Also working with our faith-based community, back to Mama Duke's point about the relationship and the importance of the Black church in Black communities, even to this very day. We all know historically the Black church has been and still is, but show enough, as my grandmother would say, the anchor to everything, whether it's social, economic, political, you name it. The Black church has always been there for the Black community. And Mama Dukes, to her credit, she continued to remind us of that. In other words, don't get so big and high and mighty that you don't understand the origins of your roots and what is really important. And then another point that we learned through, again, the eloquence and the brilliance that is Dr. Mama Dukes, is that this is not about having high profile people. It's good, it's okay. She wasn't saying we shouldn't have those people, but the people who navigate the community, that is the big mamas and big daddies and the ministers and the imam, other people who are there every single day navigating, people like you, Melvin, JJA, and Sister Wright, people who are down in that community, who have true relationship, not a drive-by relationship, but true relationship in the various communities. And I would say the way that we were pushing that on the task force is also the way that it needs to happen across the country, because big names are okay, but it is about relationships drive people to act or not to act. And if we can marry all of those things together, we have a better opportunity for everybody to roll up their sleeves on one hand to get the vaccine, and on the other hand, roll up their sleeves to talk to their sisters and brothers about their experience and why it is so important for all of us to do our part. Whether we got a fancy title or not, there is room at the end for all of us to do our part. And so this task force has been very instrumental in threading that needle, or weaving that fabric, if you will, to the governor's office to get this work done and to get more of the vaccine into the arms of the people who really, really need it.
I'm glad that you raised Charlie King. You're absolutely right. And I think Sister Arba, everybody was flabbergasted when I said, I don't want Jay-Z and Papa Boo to come into our community. I want our community to come. And so I was the loudmouth. I was the hellraiser, and they heard me. And when I knew anything, linked Jennifer, we were at a studio on a Saturday morning, like 8 o'clock in the morning, shooting Roll Up Your Sleeve. They did hear us. They did hear us. I said when I got the call, I did not want to be on a task force just for name only. And when Sister Turner, Nina, got us on a call, and we with Reverend Sharpton and Charlie King and them, they heard us that we were not here for playing because too many other people were dying. One other thing that we have not talked about on this subject is our children returning to school, the trauma. I was glad that you and Jennifer brought that up. There is not just a curriculum and the rise. I don't understand what the mayor is talking about. I will be meeting with the chancellor on May 10th. There is so much need to be done to get our children back to a learning space for them. Kids who lost parents, grandparents, babysitters, or whatever. They are traumatized and they've been locked up. Remote learning did not help us at all. Our children, Sister Arbor, know I've been raising hell like hell about our children and the devices that they didn't have. I was calling meetings every week on school about it. So we got to talk about our children. There's not a vaccine for those who are under the age of 16. What do we do? How do we reimagine our kids going back to school? That's have to be on our subject. And Abby have to be a part of us talking to the teachers' unions. You know, that's not a kind word. It's not something that, but I'm ready to tackle that also. That have to be on our plate.
All right, and we're here to support you in that in any way we can, my Dukes. And thank you for raising the school, because I think partnership and figuring out, Senator Turner talked about the great relationship that the task force has with the governor's office and how they have taken the advice of the task force in its rollout of its initiatives. I want to talk a little bit about the partnership with the city, but before we do, I want to encourage, if anyone has any questions for any of the panelists, please, you can put your questions in the chat box and we'll take them. We have about 10 minutes to go. I'd love to get to 1 or 2 audience questions if there are any. But this question is for President Rice, for ARVA. We talked about sort of the importance of partnerships with government. And now that the city just recently announced that all people are eligible to walk into any city-run vaccination site without an appointment. And Ma Duke talked about that, right? The digital divide, and you sort of how the Black community convenes. We need to just walk into, a facility to get our shot. I'm really interested in your opinion on how you think this might change the amount of people who get vaccinated. And what do you think, how can we help help the city in the process of making sure that that actually happens and it runs smoothly, that these city-run facilities are really taking in community folks on a walk-in basis?
Mm-hmm. Yeah, well, I do want to thank once again Ma Dukes for pushing for the walk-in. I mean, I think that was just an absolute game changer. And I think when it comes to young people going back to school, first of all, we have to look at whether it's going to be mandated or not, because that's going to have a huge difference on the number of people who are going to be involved and engaged. And if not, then I think we'll have very similar results as we had with the adult population, where you will see the white kids going, getting the appointments, their parents taking them to get the appointments, and you may not see as many Black kids. I think that working with children is going to require the same level of investment. We need to do roll up your sleeves, the youth version, right? So it needs to be a push and an emphasis on getting young people to come in as quickly as possible as well, but there needs to be that intentionality. Otherwise, those who are more likely to get vaccinated will automatically just go and get vaccinated. And once again, those who are not likely to do it will once once again be left there. And we need to be intentional about it. Like I said in the beginning, we know the zip codes. We know the zip codes. So if we do know that, then we need to be intentional about making sure that those young people are vaccinated at the same level. And that's gonna require investment of resources. It's going to require investment of staff. It's going to require an investment of those voices. And like Ma Dukes just said, it doesn't have to be the latest teen sensation. It needs to be, the teens that are recognizable in their communities, in their schools, and they need to start the roll up your sleeves of the youth version.
Thank you. And, Charlie King was mentioned a couple of times on this call. Just want to give him a shout out. He's watching. Hey, Charlie, thanks for bringing us together. And
Can we just say something about Charlie King and Mercury?
Absolutely.
It's a great example of partnership, business community partnership with government and with the nonprofit sector in this moment. He helped to bring us all together, to bring these diverse voices with a common goal and a common purpose together. And I think it serves as a great example for what business can do in this moment. I have a cousin who, when the vaccine when we first began talking about it coming, said, I'm not taking this vaccine. I don't trust it. And then he went on to say, unless my company tells me that they would prefer that I have it. And so we need to think about what is the role of business in this new moment. We're all doing our respective parts. You're doing your respective part. How can business support? We need resources to keep this effort going, to reach the people. But how does business use, essentially its voice and its platform to encourage people to say, we got to get back to work. We want to be safe. In order to be safe, as many of us as possible should be vaccinated. We need that in addition to resources.
And Sister Melba, I just want to add to what JJA said there. We talked about everybody has a role to play. Businesses have a role to play too, and they should support organizations like yours, organizations like JJA's, the Urban League, the NAACP. Invest those resources, help to plant those seeds so that civically based organizations can continue to do the great work that is being done. I definitely agree with JJA about how, as I call them, CK brought all of us together. And even for me, at Amari, leading Amari, and to be able to be in partnership in that way. And then also one other quick thing, just definitely got to shout out the PSAs, as Mama Duke laid out, and Jane Rosenthal. I didn't want to forget them, and also Scott Burns. They are both award-winning directors and producers. Many of you may remember the movie Contagion, which was very much ahead of its time. But Charlie King was instrumental in getting these folks engaged. And it's just another example of people taking their skill set and doing what they can where they are to be a part of the solution. So everybody has a role to play, and the business community is no exception. Resources, money for the mission.
Money for the mission, absolutely. And also too, I think that there are easy things, right? Easier, low-hanging fruit that businesses could do. And that's not to say contributing to, the organizations that are doing the work on the ground shouldn't be important, right? Financial contributions, but, like letting your employees, like Arva said, give them time to get vaccinated, or, paid sick leave and things of that nature, making it easy for people who are essential workers, right? Who are required, who don't have the luxury that some of us have. Give them that time off, give them those sort of professional resources so that it's not a burden, because they're already sort of bearing the brunt of a lot of this. But absolutely, the corporate and business sector has a role to play in this. Thank you. There was one question in the chat. We kept referring to the task force, and we were talking really about two different task force. So the governor's office has a vaccine equity task force that this task force has been working very closely with the New York City Black Task Force for Hesitancy and Education. So we've really been working hand in hand to help the governor around not only sort of how to address all of the issues that were talked about today, right? The access, the hesitancy, the messaging, how do you talk to the Black community? But also just to also do the work ourselves in the communities. Another question from the audience is how can one help encourage folks to take the vaccine. So we're all on this call. We're deputizing everyone watching this Zoom this morning to be a champion for this call, for this cause. So the question is, what are some of the tips? And the toolkit lays it all out. It's in the chat. Jennifer's like, yes. It provides all the assets, whether it's sharing it on social media, things you can actually say, things you can post. But I'd love to do just a quick round of, ways that you think folks can help encourage their family and friends to get vaccinated. Who wants to jump in on that?
Well, first you have to be vaccinated yourself.
Yeah.
You can't tell people to do something you won't do. So if you have not been vaccinated, don't try to be an ambassador, okay? And tell the truth. If you had a side effect, tell the truth, but you didn't die. You took the Tylenols, you lived. But if you don't take it, that should be your testimony. I have taken my vaccine. I did have the headache. I did have the fever for 1 or 2 days. When Jennifer did it, we did have people who owned up that they had side effects. We had people who had COVID before they got the vaccine. So whatever is real and truthful, you got to be a truthful messenger. People, don't go out there shucking and jiving. That won't help our community. Go out, as Alva said, I've had my first one. I'm going tomorrow. That's as Sister Nina said, we got to get people back who took the first one and haven't taken the second one yet. We got to say, oh, no. You won't help yourself unless you get your second one. I got mine. You got to take that second one. But that's the kind of ambassador that we need, the ambassadors we need. We need truthful ambassadors that people will listen to. If they don't do it at first, then try again.
I'll just add, we are at that point where the people who aren't are really the ones who are, like more and more vehement about not taking it. And so we have to try to meet people where they are and listen to their concerns. There's a tendency to say, that's nonsense. There's no there and just kind of be dismissive. But we have to lean in, we have to listen. I mean, one of my experiences has been talking to people who talk about not being able to trust the science and trust the medicine. And I just lean in and I look at them and I say, every time you get the flu vaccine, you don't know what's in that. When your knee is bothering you and when it like blows up with fluid and the doctor goes to give you an injection to take some fluid off your knee, you don't know what's in that injection, but yet you still lean in. So what is the difference here? Just trying to meet people where they are and have a thoughtful and constructive conversation. It's wearing, it's taxing, but every person counts in this moment. And so we just got to keep at
it. Thank you.
Amen to what we've already heard, but I do think it's about taking a moment to pause and listen. So if a person is hesitant, don't jump right away into all the reasonings, because we know all the reasonings to say, go forward with it, and we can talk about the trials, and we can talk about the testing. We can talk about all those folks, including ourselves, who are still standing and walking and doing well because we've had the vaccine. Because as Ma Duke said, that's the first step. You have to take it yourself. But I really do think that we need to take a moment and just listen to people's concerns. And so after that, you can go into the other piece. But I just wanted to echo what Jennifer said. It is so much about acknowledging where people are and then being able to move them to the next place of being able to consider taking the vaccine.
Yeah, totally agree. I mean, this is a chilling moment in human history, and we do have to pause and acknowledge that. And also, I would add, reminding people that viruses are older than humankind. That is something I think, getting caught up in this moment where this is a scary time because this hasn't happened for 100 years, and just reminding people viruses exist and we're always their job is to try to live. And that's why we see, the mutations and all the other things that are happening. We get it, that their job is to exist. That's what they do in nature. Our job as being blessed and have technology and science that we have is to be able to help humankind cope with viruses that are older than humanity for a lot of young, this is the first time, well, this is the first time any of us, for the most part, has gone through this, unless you're over 100 years. This has not happened in our lifetime. And so it's just kind of pulling back the layers and really keeping it very simple. We're going to have other viruses that we have to fight against. And guess what? COVID is going to be with us, but we need to tame it. We need to tame COVID. And that is what we are trying to do, much like we've done with the flu and any other virus that we bump up against as humankind. And that not only do we have a responsibility to humanity, we also have a responsibility to an entire ecosystem that is depending on us as human beings to do the right thing. And all of us, again, all of us have a role to play in that.
Thank you for putting that in perspective for us about viruses, right? Because that's a piece we miss all the time, right? This is a constant something that we have to work within nature, right? Because we are an ecosystem that works together. So how do we coexist together? And we often miss that. Ladies, this was amazing. We could probably talk for another hour if we had another hour. Thank you so much for your words of wisdom. Thank you for participating today. Thank you for the work that you do around this and everything else, the 12,000 jobs that you guys have to make this city a great place, a great, country, because the work that you do, and Senator Turner talked a lot about this. This is a best practice model that can be shared across the nation. So thank you.
Can I say one last thing?
Sure can.
When we get through this COVID moment and any of these COVID pounds that I've gained, I'm coming for that couture with collar that U.S. Senator, that the soon-to-be Congressperson has, but Senator Turner. I'm coming for it.
Sister JJA, it's always okay to pause for a fashion moment. It's always timely. I just want to say, can we shout out our sister Melba for an incredible job that she has done to lead and guide this magnificent panel of Black Girl Magic. Oh my God.
Indeed.
Thank you.
Thank you. With that, Stephen, would you like to close us out?
I want to just say thank you for the inspiration that our panelists are and sharing your wisdom today. I gotta say there's so much to take away. I love that there's promise in the problem that Senator Turner said. She also talked about the task force and said we cannot go with this alone. That is a core belief of ABNY, that we owe our communities to do this together. And I just want to say thank you to Dr. Dukes. I want to say thank you to President Rice, to Senator Turner, and to JJA. I didn't know you were JJA until now. And I want to add on something JJ said, which is there are bigger problems at work here, and that we should not lose this moment to together try and address those bigger issues, because they make us all better. And we owe things to our communities. We owe things to the Black community. And I think, I hope that this task force continues on and that we're able to do more together. And I just want to say thank you all. You guys are amazing.